Hello everybody, this is Dr. Zinal. I'm a pediatrician and a lactation consultant, and I will be talking on a very important topic about breastfeeding and COVID-19. I am sure by now everybody has multiple information on COVID and it is going like crazy all over the social media, all over the news. People are talking only about this. But yes, there are some mummies who do have doubts about breastfeeding. So I'm going to do this talk in a way in what I have been receiving the questions maximum in the last few days. The question which I have received the most is, Doctor, can I breastfeed my baby, or is there any chances of COVID-19 getting transmitted through the breast milk? And the answer is no. So the WHO guidelines and the IVCI guidelines says that the COVID-19 coronavirus does not transmit through the breast milk into the babies. Now they have picked up the breast milk of the COVID positive confirmed cases mothers and done the testing. Until now, there has not been any substantial evidence of any transmission, but the research is still going on. So for now, the message is very important that you please continue breastfeeding, and breastfeeding does not transmit COVID-19. The second most important question I have been asked is, Doctor, I am having cough cold. Could I be having COVID-19? There have been people who have been panicking. There have been people who are living in fear. I've got phone calls in the middle of the night with people, mothers saying that, Doctor, I'm getting paranoid. Doctor, could I be having COVID because I sneezed or because I just coughed? So let me tell you, there is no point of living in any fear. You have to live in that situation that you are having only normal cough cold, if at all you are having, and you are not going to have COVID-19 because you are at home. So you are in the safe environment of your home. So that's why very important message, stay home, stay safe, is there. So if you are, how will you differentiate if you are having normal cough cold or if you are having COVID? So normal cough cold will have symptoms like sneezing, running nose, blocked nose, maybe a little bit of cough, or you might have a little bit of headache, or you might feel a little feverish here and there. So these symptoms can very nicely be taken care of and addressed to by homemade remedies, trying to increase your immunity, increasing good amount of hot water. You can take steam inhalation. You can try home remedies like ginger, turmeric, honey, and you can do all of this and try to make your cough cold go better. What we always have been doing. There is nothing over here which you need to panic because you have a cough or because you have a cold. Now, after trying all these home remedies and after trying every possible thing, if you still feel that you have symptoms which are looking much larger than what you had previously or which are not getting better, that is the time when you'll go and consult your doctor. Now, if a mother is having cough or having cold, we have to follow a particular rule of etiquette. The most important rule of etiquette is wearing a mask. So any mother, either with a confirmed case of COVID-19 or with a suspected case, or any mother with cough cold, will wear a surgical mask. Now it is important to wear a surgical mask, preferably if you have one. If you can't find one, you can wear a normal cloth mask which is homemade. People have been flaunting all over the places different masks, so you can make your own beautiful hand material mask at home, and you can rewash it and reuse it if you wish to. Now, what are the rules of wearing a mask when you are breastfeeding? Most important, do not touch on the outer surface of the mask. So don't go and touching this mask again and again. Second, you have to discard the mask as soon as you have used it. And third, you have to be very careful that you do not reuse the mask. Okay, don't be conjuice in this and reuse the mask again and again. You have to just discard it as soon as you have used. So you can have a box of surgical gloves and you can keep wearing it and keep discarding it as and when you are using it. Another important thing is when you have cough, and suppose if you are not wearing a mask, and if you think that you are going to cough or you are going to sneeze and you're worried that it is going to go on the baby, you use your elbow. So you can wear, a full sleeves dress or something, and you can cough inside that. And that is the droplets do not go on the baby. So you're not worried that you're going to transmitting it to your baby. And you have to go and wash yourself and clean those clothes afterwards. So that is like, obviously we all are going to follow that. Now, another important thing is that you have to discard the mask ASAP. You can't leave the mask loitering around on the other bedside or loitering around anywhere. You have to pick it up and you have to discard it. However, it is to be recommended that you have to have a proper yellow bag, sterile bag, in which you will discard all the mask and you will not throw in your normal bins. If you have any symptoms, you need to wash your hands. That's more important. So I have been telling all the mommies not to use many alcohol-based sanitizers. So do not use much of alcohol on your hands because you're going to touch your babies and it's going to get exposed onto the baby's skin. So try and use normal soap and wash your hands, but wash your hands for minimum of 20 seconds. So you have to wash like sulta. Aage, piche, the finger gaps and the thumb and the wrist. Okay, so this mangat, this of complete thing you have to wash. You can't just do this and say my hands are washed, and you have to wash for minimum 20 seconds. Now the recommendation earlier was that wash every 20 minutes. Now it is not practically possible to wash every 20 minutes, but what I tell most of the mothers is that you can wash maybe every 1.5 to 2 hours when you are at home. So you can, wherever you go to the washroom or whenever you are in the kitchen or whenever you are doing anything with the baby, keep washing with the good soap and good warm water, and that should be enough. Also, this soap water thing is very important for mummies who have little bigger babies between 6 to 9 months, and they are introducing complementary feeds, and they are worried that because I'm feeding my baby, my hands are going into the baby's mouth, or if you're touching the baby too often. So using good hand sanitization and using good clean surface sanitization is very important. So if you have suspect or if you have any symptoms, clear the surfaces. The surface clearance is very important. So clear the surface of your kitchen table, of your dining table, of your baby table, of your bed, and of your side table, and very important, your mobiles, because your mobile phones carry maximum number of organisms. So it is very important to do fomite clearance. This is called clearing the fomites of anything. So keep doing the good sanitization and keep following the good hygiene practices, and there should not be any fear of COVID-19. Another important question I have been asked is, doctor, I've just delivered, and can I give skin to skin contact to my baby? So yes, you should be giving skin to skin contact to your baby. So the mummies who are pregnant over here, this message is for you all. You should be doing the kangaroo mother care, and you should be picking up your baby and putting to breast immediately. You should be doing initiation of breastfeeding within the first 1 hour and continue exclusive breastfeeding. So this is a very important thing. There is no need to fear and panic and say I do not want to breastfeed. Let me tell you, the stress is only going to reduce your milk supply and do no good to you. So try and do exclusive breastfeeding whenever you deliver, wherever you deliver. Okay, so it is important that you pick up your baby, give your baby your emotional support, give the baby the sense of security, and exclusively breastfeed. Within the first 1 hour, you have to start breastfeeding. That is very, very important wherever you are. Now, this question has also been asked to me that, doctor, around me there are people who have COVID-19. Okay, in a community I had got a call that somebody else was detected, and that mother panicked and she said, oh my God, what will happen to me and my baby? Now can I breastfeed? So again, the answer is yes. So even if there are people around you who have had any infection or who are suspected to have infection, you should be protecting yourself and your baby. So the best is to keep those people away, and you take care of yourself in a room where you don't allow many people to come inside or to go out, or not many people coming and touching your baby. So I think God has given you this time where you can be in touch with your baby and you can take care of your baby completely on your own. So why do you need people also to come and take care of your baby? So you can have you mother alone taking care of the baby and exclusive breastfeeding. That is going to be very, 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 very crucial, without panicking and without getting into a fear zone. So take care of yourself and take care of your baby by being happy, enjoying your motherhood, doing good breastfeeding, and not giving any formula. So let me tell you over here, you are giving something from outside to your baby. I think that is more dangerous, because you don't know what kind of a formula. There has been shortage with lot of supplies. So you don't know, and with the water you are giving, and you are preparing, you're using the in-between intermediates like katori, chammach, syringes, nifty cups. Why do you want to even go there? So best is direct exclusive breastfeeding. Now, if a mother is suspected or is having COVID-19 and is in the hospital for some reasons, then what is to be done? So if the baby is at home, the ideal situation would be to send express breast milk. So by any chance, if the hospital allows or the doctor permits, the mother should send the milk at home for the baby. Now again, while doing the expression, you have to be very careful of the hand hygiene. She has to be very careful that she does not touch the milk, and the milk should go directly into the container, which is sterile, and then you pack it and send it home for the baby. So there are little rituals which are mentioned if you have to express breast milk. Now a lot of mummies have also been expressing breast milk who are feeling sick, or who have been feeling a little under the cover, or who have been having symptoms, or who are in the hospital. Yes, you can do that. There is no harm in doing that, but you have to follow the hygiene and the sanitation before you express the breast milk. Now another question I have been asked is that, doctor, can I give formula? So as I said, no to complete formula. Try and give only mother's milk, and you can continue mother's milk without any risk or without any fear. So my important message to all you mummies is that if you have any lactation related queries, or if you are having any issues with regards to breastfeeding which you are facing right now, and since you are unable to go out and help, we all are here as a team to help you. You can just get back on us, and we will revert to you as soon as we can with your query. So enjoy your motherhood, be safe, stay happy, and God bless all. Thank you.